Based on the assessments, Ms. Davis, you may have periodontitis. Let me explain to you what periodontitis is. Periodontitis is an irreversible disease in the mouth that causes destruction to your tissue and bone. There are 3 different stages and grades for periodontitis. So I'm going to be going over the stages of periodontitis. There are 4 stages of periodontitis. The stages are to classify the severity of the patient's disease. The primary determinant is the clinical attachment loss, and if the clinical attachment loss is not available, then we will look at the radiographic bone loss. So these are the 4 different types of stages. There's a mild to stage 1, stage 2 are mild to moderate, stage 3 and stage 4 are moderate to severe periodontitis. I'm gonna go over the grading. So there are 3 grades. This is the progression of periodontitis. So grade A is slow, grade B is moderate, and grade C is a rapid progression of periodontitis. Diabetes and smoking does come to effect in the grading of periodontitis. So if you are a non-smoker and you have no diagnosis of diabetes, you would fall into grade A. For grade B, if you are a smoker and smoke less than 10 cigarettes a day, then you will fall into grade B. Or if you have diabetes, which with a HbA1c less than 7%, then you are a grade B as well. For grade C, if you're a smoker and smoke more than 10 cigarettes a day, then you are considered in a rapid progression of periodontitis. Or if you have an HbA1c more than 7%, you will also be considered a grade C patient. Based on all the assessment, it concludes that you may have stage 2 grade C periodontitis. You have some 3 to 4 millimeters clinical attachment loss and generalized 4 to 5 millimeters deep pockets. I'm just going to show you your x-rays. As you can see that there is some tissue destruction and some bone loss. The reason why you may have periodontitis is because of your diabetes. As we went over the staging and grading, diabetes is a systemic disease that can be the cause of periodontitis. According to your dental history, you said that you had your first molar also extracted 4 years ago due to a periodontal abscess. The abscess could have been caused by your diabetes. Some oral health considerations as a person that has diabetes would be enlargement of your gum, abscess, some poor healing, infections, oral ulcerations, numbness, or some burning in the mouth, and there are other considerations as well. Ms. Davis, according to an assessment, your plaque index score is 2.1. Meaning it's a very poor score. You have a lot of biofilm accumulated on your teeth. You may ask, what is biofilm? Biofilm is a sticky white substance made of bacteria that forms around the surface of your teeth and gums. Biofilm can start to accumulate when you are not brushing properly and are missing certain surfaces on your teeth. Biofilm can become tartar after about 12 days. Tartar is a hardened plaque on the teeth that can only be removed by using our dental instruments. Biofilm can be easily removed by brushing properly at home, using a proper toothbrush, and flossing daily. So I'm going to be showing you how to use a power toothbrush. So I'm going to be using this model. To use a power toothbrush, you're going to put some toothpaste on it, and then you're going to place the toothbrush at a 90-degree angle. Before you turn it on, you're going to slightly tilt it upward to a 45-degree angle because you want to get beneath the gums and remove all that bacteria under your gums that's causing inflammation. So always make sure to go under your gums. So always go at a 45-degree angle. And you're going to turn it on. And you're gonna leave it there for at least 5 seconds, and then you're gonna move slowly. So now we're gonna talk about the treatment plan. So to remove all that plaque and tartar from your teeth, we're gonna be using the ultrasonic, which is a power device that does shoot out some water, but it's gonna remove all that plaque and tartar. And when that plaque and tartar is removed, your gums are gonna be able to heal in at least a month. It is gonna reduce inflammation, reduce some of the bleeding, and definitely make your gums feel healthier and look healthier. We're also going to be using some pain management, some topical gel to reduce any discomfort or pain when using the ultrasonic. Okay, Miss Davis, that is all for today. I'm just going to remind you about a few things. Make sure you make an appointment to come back in 3 months for treatment evaluation. We are going to be doing some new assessments, making sure there is improvement in your oral health, if there has been any reduce in your providence, and any healing in your gums. We want to make sure we are preventing the progression of periodontitis. Ms. Davis, I'm also going to remind you that I do recommend you purchasing that power toothbrush and floss picks, and make sure you're brushing at least 2 to 3 times a day and flossing at least once a day, so you can have that proper dental care at home. And that's all for today, Miss Davis. I'll see you in 3 months, okay? Have a good day.